Good evening to everyone and welcome to today's session. Preventive and social medicine. We have finished discussing 820 questions of past 15 years of All India topic-wise classified. After that, now we are going to crack about another 500 questions from the aims in the past 15 years. So totally there are about 1600 questions in a total period of around 20 hours. We are going to become the champions in the preventive and social medicine. PSM, microbiology, and these are all some very dry subjects, unlike psychiatry, ophthalmology, general medicine. They're all clinical subjects, right? So you have to mug a lot. You have to master some of the most commonly tested high-yield facts. That is the reason we are taking a little long. Please bear with me. And after this session is over, this video will be removed and uploaded into onlinemmbbs.com video library, where you have almost 1500 high-density videos for you to do the quick revision, right? So make it a point to subscribe to the onlinemmbbs.com. So let's make the great beginning. Sai, Prasad, and many more who are all online. So before we start the session, we run the quiz tournament. The idea is you answer some of the common questions and exercise your mind, and that will help you to participate in the session with more energy every day. Commonest cause of the neonatal mortality is the low birth weight, is what you need to remember. The low birth weight. Yeah. So the neonatal, post-neonatal mortality, everything you have to be 100% sure. Good to see Rifa Riaz and Ritu Raj, Sai, Prasad, and many more. Good. When you calculate the dependency ratio, what is the formula? The denominator has the population between 10 to 65, under 10 and above 65. So the number of dependents in the population aged between 15 to 64. So the numerator is those who are below 15, above 64 are called dependent people. Residents of 3 villages with 3 different types of water supply to identify cholera carrier. The proportion of residents in each village was computed and compared. So you are comparing one proportion with the other proportion with the other proportion. That is, in one given point of time, is basically called a cross-sectional study. न्यू फैमिली का मतलब क्या होता है? द न्यूक्लियर फैमिलीज, पति पत्नी और ओ छोटा उनका, इनको बोलते हैं न्यूक्लियर फैमिली. So all the nuclear families of less than 10 years of duration is termed as the new families, is what you need to remember. A drug company developed a new pregnancy test kit And pregnancy test was used on 100 women who are known to be pregnant. 99 showed positive. The same test on 100 non-pregnant women, 90 showed negative. So what is the sensitivity? It is all a question of knowing the formula and forming the A, B, C, D 2+2 table. So doctor, true positives, false negatives, true negatives. You should know to draw the 2x2 table. Then true positives by true positives plus false negatives. Specificity is true negatives by true negatives plus false positives. And positive predictive value, true positives by all positives. Negative predictive value is true negatives by all negatives. जितना बार भी पढ़ो बात यही होता है और इसको याद रखना. A man presents with fever, chills, 2 weeks of louse bite, and there is a maculopapular rash on the trunk, which is spreading peripherally. It is a classical case of epidemic typhus. So whenever typhus fever is there, doctor, the fever rises to 39 to 41 degrees Celsius and it is persistent. Patients who are having typhus have relative bradycardia. Whenever fever is there, you are expected to show tachycardia. If the rise of the heart rate is not proportionate, then that is called relative bradycardia. Tachypnea and cough can be the feature of scrub typhus. There is a maculopapular petechial rash, especially epidemic typhus and murine typhus. Murine typhus का दूसरा नाम है endemic typhus. Rash will be petechial. Epidemic typhus को बोलते हैं louse-borne typhus because it spread to human via the body louse. There's a lot of myalgia, fever, headache, central rash, etc., etc. And a lot of people died in World War II because of epidemic typhus. It's a lousy war. Q fever is a zoonotic infection, interstitial pneumonia, and no rash is seen, and Wien Felix is not useful in case of the Q fever. So what is the reservoir of Kala Azar? If you take the most recent NEET PG exam, doctor, every NEET PG में एक vector cycle, life cycle of the infection दिखा के भैया ये कौन सा vector borne illness बोल के एग्जामिनर पूछेगा. So that is the reason you have to be very sure on all these life cycles. Reservoir of Indian Kala Azar is the man. So typically there is, if you look at the cycle of the Leishmania, in the human beings, it is taken by the macrophagic cells that release mastigotes, which inject into other cells. And the mastigotes are the form taken up by the sandfly, which is an intermediate host. And it will parasitize other cells, release the mastigotes, multiply in the gut, and release the mastigotes. And they change to promastigotes. And typically, the sandfly inject the promastigotes into the mammals. Is what you have to emphatically know anything, everything about the vector, intermediate host, etc., of the Leishmania. Asbestosis can lead to pleural mesothelioma. Sputum has got asbestos bodies, and the disease progresses even after removal of the contact. But it occurs. At least 10 years exposure is required. A screening test was used in the same way in two similar populations. But the proportion of false positive among those who test positive in population A is lower than those in the population B. So, एक population में false positives are typically more. Another population, false positives are less. So what is the likely cause? Is there a relation between specificity and the false positivity? Yes, there's a inverse relation. The greater the specificity of the test, lesser will be the false positives, more will be the true positives, because specificity is the ability of a test to detect the true positives. Higher the specificity, higher the true positives, and lesser will be the false positives, is what you need to basically remember. So you call a test 100% specific, iska matlab hai there are no false positives. 80% specific means typically 80% of the patient without the disease are turned out to be negative, that is true negatives. But 20% of the patients are incorrectly identified, that means they are false positives. So higher the false positives, lower will be the specificity, is what you have to basically remember. An investigator wants to study the association between the maternal intake of the iron and the birth weights in the newborn babies. He collects the relevant data from 100 pregnant women and their newborns. So he compared the mean values of these birth weights. So there you will use independent t-test. The independent t-test का दूसरा नाम क्या है? Two sample t-test. इसका दूसरा नाम है two sample t-test, otherwise called student t-test. It is the statistical test that determines whether there is any statistically significant difference between the means in the two unrelated groups, is what you have to emphatically remember. The usefulness of the screening test, it depends upon its sensitivity. For testing the statistical significance in the heights of the school children among three different socio-economic groups, what is the best test? Three, not two. Three, bola. That's the reason you need to use ANOVA, analysis of variance. Whenever you want to know the differences among the group means in a sample, more than two, then you use analysis of variance. For the field diagnosis of trachoma, WHO recommends that follicular and intense trachoma inflammation should be assessed. So typically in the children aged 0 to 10 years, what is the age group where trachoma surveillance need to be done? An investigator wants to know the association between iron supplements and birth weights. So what is the best test of hypothesis? Typically, chi-square test is the one which is advised. So once more, discrete variables where yes or no is the answer, there you are comparing proportions. Continuous variable where you are calculating the mean value and comparing the means. Student t-test is for the means. Chi-square is for comparing proportions in the discrete variables, is what you need to remember. Under the National Program for the Control of the Blindness, medical colleges are classified as eye care centers. So mainly what do you do there? Rehabilitation. So that is the reason they are considered to be tertiary level, is what you need to remember. If 3/60 is used as the definition, the number of blind persons per 1 lakh population in India will be around 1,000 blind people will be there if 3/60 is used as the criteria. If the prevalence is very low compared to the incidence, uska matlab prevalence is equal to incidence into duration. So इसका मतलब है the disease is very fatal, सब लोग मर जा रहे, or easily curable, so that there are no more cases. So that makes the prevalence come down. The moment duration of the illness decreases, the prevalence also will come down, is what you need to remember. Prevalence and incidence. If you look at the prevalence is not a rate. New cases plus old cases by population. So it is more or less a kind of a proportion where numerator is the part of the denominator, is what you need to remember. The rate adjusted to allow for the age distribution of the population. What is that called? The age standardized mortality rate. So if you want to compare two different populations, any particular, for example, diabetes से कितना लोग मर जा रहे बोल के आप चाइना एंड जापान को कंपेयर करना बोले तो जापान में बहुत बुढ़े लोग रहते हैं, ओल्ड पीपल आर मोर. चाइना में बहुत जवान लोग मिलेनियल्स रहते हैं. सो इन दोनों का एज स्टैंडर्डाइजेशन करना पड़ेगा for you to compare the mortality rate between the two. Then only you can make a meaningful inference. The fasting blood level of the glucose for a group of diabetics with a mean of 105, standard deviation 10, 95% में 105 plus 2 into 10, 105 minus 2 into 10, 2 into standard deviation from the mean value will be the typically 95% of people will fall into. So that's the reason it is 85 to 125 milligrams is what you need to remember. The age and the sex structure typically is described by population pyramid. The other day we have seen how will be the different entities and their population pyramid. So good to see Davaluri, Lavanya. So keep proactively participating, doctor. I appreciate Ritu, Rifa, Lavanya and many more for punching your answers. Now, in a double-blinded clinical trial, typically what happens? In a double blinding, neither the patient knows agar wo treated or placebo group kahan ja rahe, nor the investigator knows where he is sending the patient to. So both of them are blinded basically. The most sensitive index of the recent transmission, recent kaun aaya, bachcho aaye. So इसलिए infant parasite rate will give you the most recent transmission of the malaria is what you need to remember. How much additional energy daily is required in a 6 months for a lactating woman? Additionally, 550 kilocalories देना पड़ेगा. Bagasosis is the sugar bag, sugar cane occupational disorder. Very good to see Anuja, Parvez and many more. Very good, doctor. Every day we hope to start session at 6 p.m. कभी-कभी गुरुजी आने के लिए जरा देर हो जाएगा क्योंकि Dr. Murali Bharadwaz is also having a responsibility with his patients, right? So कभी-कभी delay होगा, 6-7 होगा, 7-8 होगा, 8 नहीं है तो 10 होगा. मगर आपको पढ़ाई देने के बाद, आपके साथ पढ़ाई करने के बाद then only we will go to sleep, right? So at least 1 hour of my life, I promise to hold your hand, sit along with you, study along with you. So thank you so much for joining the session, and please be part of our helpline WhatsApp group 9000868356. If you are not yet part of our WA group, become part of it. The moment the session is starting, we will shout out that hey, class is starting. Also share about our YouTube channel to all your classmates in the college, WhatsApp group, Facebook groups everywhere. We want to help as many number of people as we can. 365 days. Sunday ho ya, Monday, Diwali ho ya, Dashara ho, Dr. Murali Bharadwaz will be available to spend 1 hour with you studying for the NEET PG and FMG preparation. So, doctor, general fertility rate, how do you define? Typically, the denominator has the woman 15 to 49 years of age. In the denominator is what you need to remember. So the other day we have studied now, how do you calculate net reproduction rate, total fertility rate, blah, 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 everything, all formulas we did the revision. If you missed those classes, please go back to the earlier videos on the onlinembbs.com. After the class is over, we remove the video from the YouTube, process it, and then upload it along with the PowerPoint notes into the onlinembbs.com video library. Mites are the vectors of which diseases? Scabies, scrub, typhus, rickettsial pox, not the KFD. KFD is a tick-borne viral hemorrhagic fever is what you need to remember. The mean and standard deviation can be worked out in which kind of data? Basically, if the data is on an interval or a ratio scale, interval scale or ratio scale pai hai to mean value standard deviation is up, not on the nominal or ordinal scale. Now comes a quick revision. इसके पहले भी बहुत डिस्कस किया इसके बारे में बायोस्टैटिस्टिक्स में. If you go to the onlinembbs.com video library, 15 hours discussion of nearly around 300 MCQs from the biostatistics along with the PowerPoints. They're all available on the onlinembbs.com video library. So please take every chance to go back and do the revision, doctor. वो 15 hours अगर आप मुझे दे दिए तो मैं आपको बायोस्टैटिस्टिक्स में परफेक्ट बनाऊंगा, 100% guarantee, right? So let us look at the scales of measurement. This is one of the favorite questions, once more, frequently asked. Nominal scale, ordinal scale, interval scale, ratio scale. Whenever it is a qualitative measurement, qualitative, जाति और रीति का विभेद के बारे में बात कर रहे तो नॉमिनल होगा, ऑर्डिनल होगा. Quantitative, where measurement is done with a numerical, then it is interval or ratio. Ratio scale is what you need to remember. Nominal scale, quality होता है. For example, gender, male, female. Can you say 10 males is equal to 1 female or 5 females is equal to 1 male? No. Marital status, married, unmarried, divorced. Similarly, state of residence, zip code, student ID, they're all examples of what? Categories, categorical. So that is nominal scale. Ordinal scale, categories are set and are ordered from least to most. Miss America, first place runner, second, third. Similarly, the degrees held. Similarly, medical condition, satisfactory, serious, guarded, critical, Glasgow Coma scale, they're all ordinal scales. Interval scales क्या होता है? Interval and ratio are qualitative, quantitative. So it is a scale with values and there is the same numerical distance between each value. And the scale has an arbitrary 0 point. For example, if you are taking the questionnaire, how is the performance? 1, 2, 3, -1, -2, -3. So between -1 to -2, -2 to -3, ये जो distance है ना, that is a meaningful distance. And there is a meaningful, there is a 0 point, but that is not a true meaningful 0 point. Then ratio scale. Once more, it is a numerical scale with scores where there is a same numerical distance between each score, but this has got a true meaningful 0 point. So what is the weight of the package of a candy? So it is a true 0 point. You can make a ratio comparison. Like Ramu's income is 35% more than Bhimu. That is a ratio scale. So once more, nominal, ordinal, interval, ratio. Ordinal, nominal are categorical, qualitative. Whereas these are quantitative, is what you need to remember. So I leave the literature for you to do the revision. बहुत questions पूछते हैं examiner frequently. The national level system that provides annual national as well as state level estimates of fertility and mortality. इसको क्या बोलते हैं भैया? इसको बोलते हैं sample registration system. कितने दिनों में डेथ को रिपोर्ट करना, कितने दिनों में बर्थ को रिपोर्ट करना, वो सब स्टैंडर्ड्स का होता है सैंपल रजिस्ट्रेशन सिस्टम. You have applied a statistical test. Investigator gets the p-value as 0.01. इसका मतलब क्या है? That means the difference is not significant. 1% times, and it is significant 99% of times. Non-significant 1% of time. Significant 99% of time. That is the meaning of p-value is 0.01 is what you need to remember. Now, mean hemoglobin value of a sample of 100 pregnant women was found to be 10. What is the standard error? Already we discussed the standard deviation divided by square root of n will give you the standard error. Standard deviation कितना है यहाँ? बच्चों, यहाँ कितना है? 1 divided by square root of कितने बच्चे हैं? 100. So 1 by square root of 100 is equal to 1 by 10 is equal to 0.1. Earlier also we answered this question. For every 1 lakh population, the highest prevalence of the blindness in the world is the sub-Saharan Africa. Plague. The domestic rat is the main reservoir. Is wrong. Wrong except means what is true. Bubonic is the most common variety. That is true. So you have a pneumonic, bubonic, septicemic. Bubonic plague is the most common type of the plague, is what you need to remember. Bubonic plague. There will be swollen lymph nodes. Within a week from infected, flea bites you. Septicemic is least common. Pneumonic affects lungs, most dangerous, and symptoms within few hours after infection. So wild rodents are the natural reservoirs of the plague. In India, the wild rodent Tartara indica is the main reservoir, is what you should remember. So if you look at the bubonic plague, 2 to 6 days incubation period, whereas pneumonic plague 2 to 4 days, septicemic plague 1 to 6 days. National Health Policy of India, what does it include? So originally there was a great national health policy in 2002. I was the topper in the MD entrance exam in the year 2000. उन जमाने में ये नेशनल हेल्थ पॉलिसी अभी आया. All other entrance exams में routinely one has to do the mugging. So polio eradication, leprosy, kala azar, filariasis, when to get zero level growth of HIV, etc., etc. So later, the national health policy, originally in 1983, and then 2002, with a lot of goals to be achieved by 2015. Then 1st January of 2015, Niti Aayog, National Institution for Transforming India, replaces the Planning Commission. The incubation period of yellow fever is 3 to 6 days. Q fever mainly by inhalation of aerosols. Staphylococcal food poisoning incubation period is within 1 to 6 hours. And optimum temperature for toxin formation is around 37 degrees Celsius. So once more, doctor, food poisoning होता ना examiner के लिए favorite food to poison you in the NEET PG exam. बराबर incubation periods को पट्टी मार के जाना है. I already gave you that list, doctor, in my earlier discussion yesterday. Short duration acute disease का severity कैसे पता चलेगा? Case fatality rates. What are the most common cause of the maternal mortality in India? Hemorrhage. ICDS, Integrated Child Development Service, is under which ministry, doctor? HRD, Human Resource Development Ministry. एक जमाने में who is the minister? Smriti was the minister. So vitamin A prophylaxis, Ministry of Health and Family Welfare. Prophylaxis against nutritional anemia, Family and Health and Family Affair. Iodine deficiency, Health and Family Affair. Special nutrition, Social Welfare. Balwadi, Social Welfare. ICDS, Social Welfare. But I will ask you a tricky question. Midday meal program. It is not the social welfare. It is the education department. Is what you need to remember. Then, vitamin A prophylaxis program. Typically, it was launched in 1970. Vitamin A, 2 lakh international units orally to all preschool children in the community every 6 months through peripheral health workers. Prophylaxis against nutritional anemia. Iron and folate to the pregnant women and young children. through the MCH, Mother and Child Centers in urban areas, and primary health centers in rural areas. Control of iodine deficiency disorder started in 1962. Special nutrition program was started in 1970. Children below 6 years of age, pregnant and nursing women are all the beneficiaries. The supplementary food, kitna rehna? 300 kilocalories and 10 to 12 grams of protein per day for the child. And the supplement is being, the beneficiary mothers, 500 kilocalories and 25 grams of protein. And the supplement is provided for about 300 days. It was centrally sponsored program. Later on, it was transferred to the state sector in the 5th five-year plan and the minimum needs program. Then ICDS, Integrated Child Development Services. It was started in 1975. And the beneficiaries are the preschool children below 6 years, adolescent girls 11 to 18 years, pregnant and lactating mothers, ICDS. And the workers at the village level who deliver the ICDS are Anganwadi workers. Each Anganwadi unit covers a population of 1,000, is what you need to remember. And the work of the Anganwadis is supervised by Mukhya Sevikas, is what you should remember. Then midday meal program, 1961. And midday meal jab banate hain, what are the recommendations? The meal should be supplement and not a substitute to the home diet. Just like online coaching program should be a supplement but not a substitute. Once upon a time before COVID aane ke baad online coaching ban gaya substitute. Then meal should supply at least 1/3 of the total energy requirement, 1/3 of the energy, 1/2 of the protein is what you need to remember. So cereals and millet 75 grams, pulses 30 grams, oil and fat 8 grams, leafy vegetables 30 grams per day per child. That is what you need to remember. The systematic distortion of the retrospective studies that can be eliminated by a prospective design. Retrospective studies में आप पिछले साल क्या खाया, उसके पहले क्या खाया, क्या पिया बोल के क्वेश्चंस पूछ ले. किसको याद है भाई क्या खाया हम, क्या पिया हम? सो इसलिए जब भी आप रिट्रोस्पेक्टिव जाते हैं, रिकॉल बायस का प्रॉब्लम होता है. और रिकॉल बायस का प्रॉब्लम प्रोस्पेक्टिव डिजाइन में नहीं होता है. दैट्स व्हाट यू नीड टू अप्रिशिएट. सो इफ यू रिजेक्ट द नल हाइपोथेसिस, तो द नल हाइपोथेसिस इज ट्रू. दैट्स कॉल्ड टाइप 1 एरर. दोषी को निर्दोष बोल के फ्री कर दिया आपने, बाहर भिजा दिया, वो होता है टाइप 1 एरर. और जो दोषी है उसको निर्दोष करे तो द सेकेंड टाइप ऑफ एरर. In a new effective treatment is initiated and all other factors remain the same, what will happen? It's a new effective treatment. That means it has a more impact in curing the new cases. That's the reason it will have an effect on the prevalence, not on the incidence. Incidence is only new cases. So, different parameters of the performance of the test. Sensitivity inversely related to specificity. That's what you need to remember. So now the newer tuberculosis program aa gaya, but category 2 mein, what is the recommended treatment? 2HRSZE3 plus HRZE3 plus 5HR3. So all the dots regimes, you have to be very sure. Dots plus क्या होता है भैया? मल्टी ड्रग रेसिस्टेंट ट्यूबरक्लोसिस को ट्रीटमेंट देने के लिए हम 6 ड्रग्स का इस्तेमाल करते हैं अंडर डॉट्स प्लस. Kanamycin, levofloxacin, ethionamide, pyrazinamide, ethambutol, cycloserine during 6 to 9 months of intensive phase. And levofloxacin, ethionamide, ethambutol, cycloserine during 18 months of the continuation phase is what you need to remember. So what is the sampling method for assessing the immunization status of the children under the immunization program? It's called cluster sampling. So different methods of sampling. वो सब चीजें हमने डिस्कशन किया. एग्जामिनर के लिए बहुत खास बात होता है. With regard to break point chlorination, एक बार break point chlorination पहुंच गया तो free chlorine is released. Just like chlorination, doctor, even your NEET PG preparation should reach the break point reach करना. एक मर्तबा 950 topics revision करो, automatically you will reach the break point. So what are those 950 high yield topics? Online MBBS.com video library में 1500 HD videos में, high density videos में, you have these 950 topics. गर्मा गर्म डिस्कस कर चुके 427 hours में. Please go back to online MBBS and do the revision. Chlorine demand is the amount needed to kill the bacteria, oxidize the organic matter, neutralize the ammonia. Contact period of 1 hour. So whenever the free chlorine exceeds the combined chlorine level by at least 2:1, and the combined chlorine concentration is at least 1 milligram per liter, then break-even point has achieved, and there is sufficient free chlorine to combine to continue the oxidation. So Government of India provides iron and folate. उसमें 100 milligrams of elemental iron is what you have. Maximum number of AIDS cases. Every year the statistics keep changing, doctor. Be very sure about it. Some states have high prevalence. Maharashtra, Tamil Nadu, Karnataka, Andhra Pradesh, Manipur, Nagaland. Low prevalence states is whenever it is less than 5% in the high risk groups and less than 1% among the antenatal women, you call group 3. Group 2, moderately risky. Gujarat, Goa, Pondicherry. All holiday picnic spots. HIV infection has caused 5% or more among high risk, but the infection is below 1% in antenatal women. So that is how you basically divide. So, doctor, that brings us to the end of today's wonderful journey. रोज मिलेंगे, रोज पढ़ेंगे, रोज जरा कॉन्फिडेंस बढ़ाते आगे बढ़ेंगे. Be with Dr. Murali Bharadwaz every day, and after the session is over, at least promise me 2 to 3 hours you will consume the video lectures on the online MBBS.com video library and PowerPoints. You don't need anything else. You just need to be in the game. That is important. Every day in the game. Tough day, bad day, good day, doesn't matter. But at least 2 to 3 hours, padai karo mast. If you spend 4 months with Dr. Murali Bharadwaz, every day 1 hour's class live and another 2 to 3 hours of revision of at least 8 to 10 topics, high yield topics on the online MBBS.com video library. Every weekend take a full scale grand test. You will crack the entrance exam. I can guarantee you. Right, doctor? Good night. Once more tomorrow at 6 p.m. with all of you. Have a great evening. Thank you.